Welcome back to The New Norm. I'm Dr. Lou Graham, and this program is brought to you by Midway Dental and Catapult Education. So here we are in month, I'll call it two and a half, who knows, I've lost count, of getting back in the COVID era. In fact, it's crazy. People are calling it the post-COVID era. I have no idea how anybody can call this the post-COVID era. Okay, I know. So with that said, I wanted the new norm to start going off into not necessarily a new tangent, but open dialogue up. An open dialogue up with what are dentists doing uniquely in the space to re-energize their practices. Let's get some tips and tricks, and let's start collaborating more. We'll still be bringing you so many cool new things, but I really wanted to start off the next phase of the new norm with great interviews. So who better than one of my bestest friends, Susan McMahon in Pittsburgh. So just a little bio. So she started practicing in the early 90s in Pittsburgh area. And in the late 90s, and we're gonna get into a little bit of really cool stuff with Susan, the late 90s, she really got back. She really started her career more into cosmetic dentistry with a lot of great AACD courses and disciplines. Began accreditation around year 2000, got fully accredited in 2005, and I'm gonna tell you, she rocks. She joined my practice as a part-time dentist. She would fly in, she has family in Chicago. It was the best. And she was relaunching a new practice in Pittsburgh, so she flew in, worked with me, and then as her practice grew and grew, she left me to go back to Pittsburgh. I totally understood. And with that, she really is one of the, I say, finest cosmetic dentists in the United States. And we're gonna focus on that. But first, I just wanna welcome Suze to the program. Welcome, Suze, it's great to have you.
Hey Lou, it's so good to be here. Thanks for having me on. You know I miss you. The day I stopped coming to Chicago to your practice was a sad day for me.
Yeah, sad day for all of us at the office. We loved our Suze. So I got to talk a little bit about personal life. I think in our friendship, I think COVID, and even before COVID, I think it'd be interesting because you represent to me a key factor, the wonderful changes of women in dentistry. And I know you're so proud of that. If you don't mind, just for 1 minute or 2 minutes, could you take us through where you were in dental school, through the ACD, family kind of stuff, if you don't mind, because I think this is a part of the specialness of you. Take it away.
Sure. So in dental school, I actually had 2 kids in dental school. I had my son when I was a second-year dental student, and I had my daughter the year that I was graduating. And
Wow.
And back when I was in dental school, there were 197 people in my dental school class, and 17 of us were women. So it was a very low percentage of women in dental school.
Yep.
And it doesn't seem like that long ago. And we all know now
Right.
that there's slightly more women in dental school than there are men. So
Right.
it's like 52% to 48, something like that, right? But
Right.
and there were some incredible women that were ahead of me in dentistry that really paved the way for us. And so awesome things happened. But I had 2 kids in dental school, and then I got out and was an associate for a little while in an amalgam practice. And I kind of knew that just wasn't where I wanted to spend my time. And I opened my own practice, and I was a PPO office. You know, I was doing insurance. I was doing all the things that everybody was doing at the time, and kind of just grinding it out. And I was walking through a dental meeting here in Pittsburgh, and I saw a laser whitening system. It was the Bright Smile laser whitening system. And I thought, oh, that's cool. You know, that's the coolest thing ever. And I signed a contract for a $100,000 laser whitening system and had it delivered to my office.
God.
Kind of spontaneously. Would not recommend that, signing contracts without reading them, right?
Right.
But anyway, it launched my cosmetic career. I brought it to the office. We realized that people really wanted it. I started kind of doing marketing, and it was the beginning of my marketing for my practice, which I still do today. Through the years, I've done radio, TV. Now we do digital campaigns. But it's important to attract the kind of patients to your office that you want to treat. And I think one of the only ways to do that is actually through marketing. So I started to market, and people were coming in droves to have this done, paying us, I think, $1,500 to have their teeth whitened with this Bright Smile system. Super, super painful. Like, people were really in a lot of sensitivity and pain having it done, and they still got it done, and they were still paying us a lot of money to do it. And I sort of realized, oh, this is something. People will pay for elective procedures even though they're uncomfortable because they want to look a certain way. And that sort of launched my cosmetic career. I joined the AACD, and so by this time I had one more kid. So I had my 2 older ones, and then I had a baby, and I joined the AACD and started down their accreditation path. And I became accredited in 2005, which was coincidentally the year my son graduated from high school and started to college. So he was with me my whole career through dental school and college.
Wow.
And he went to college, and my second kid went to college. My daughter Kara went to college. And when they both finished college, a year later, I finished paying off my dental school loans. So I had 2 kids all the way through college before I was done paying off my loans. And sometimes I know that lots of people are coming out of school saddled with debt these days. But there's light at the end of the tunnel, and even if it takes a long time, there's still incredible success along the way and at the end.
Agreed. So I got to ask you. So that's what I love about you. It's called perseverance, and we're going to make this stuff happen because that's my MO. I couldn't agree with you more. Okay, so in March, COVID hits. Now, people don't know this about you. So COVID hits, and most dentists go, OMG, my dental office is closed. Yeah, okay, that happened to you, but it happened also in a different kind of way. I think it would be fun for just briefly to tell everybody, how did it hit you in a dual way? Go ahead.
Yeah, so my practice is cosmetically oriented. I do mostly elective cosmetic procedures, and we've been going gangbusters for the last several years. But COVID hits in March, and I'm also a partner in 2 restaurants here in Pittsburgh called Bacon. They're kitschy, brunch all day, really fun restaurants, and we've had incredible success over the last few years. We've been on the Food Network a couple of times, on the Travel Channel. People wait in line every weekend to come and eat at our restaurants. And March 15th or so, we got the order to close our restaurants and close our dental practice at the same time. And I can tell you, never could I've ever imagined a scenario where those 2 businesses would be totally shut down at the same time.
The stress and all that, and even now, how much? And I swear I'll get to dental, but this even now, how much can how open are your restaurants even now?
Oh, here in Pennsylvania, we are allowed to have a 25% capacity and do takeout. So basically, COVID is euthanizing restaurants all over the country, and certainly here. It's a slow, painful death. Yeah. There's no business model that allows you to do a 25% business and stay away, stay in line, right?
Now, listen, I know you're doing gangbusters in your private practice, and I'm still only at really about 75-80% in month 2, which I'm thrilled to be at, going through all those changes. But I want to now focus on elective care, because you've always been about elective care, cosmetic dentistry, now getting into sleep. We're not going to get into sleep today, but talk to me about what you're seeing now in this COVID era with elective dentistry, the shifts that you're seeing.
I guess I can start by saying last month was my busiest month I've ever had in my dental practice, ever, in my entire career. So that's really encouraging, right? But I love that. Yeah, this is sort of reminiscent of 2008-ish, right? When we had the recession. Up to that point, it was gangbusters in cosmetics. There was nothing I could diagnose, or no amount of money I could say where people wouldn't say, okay, let's finance and do it. And we were just so busy. The recession hit, dried up. But what happened then, and what I'm certainly seeing now, and even more so, is that younger people are still seeking cosmetic care. And they're seeking it in droves. The numbers are threefold from 5 years ago of younger people seeking cosmetic surgery and cosmetic dentistry. So my practice has been focused on this for a number of years. So as soon as COVID hit and we shut down, we realized that people were still calling us looking for consultations. Even 3 days after we shut down, in the height of COVID, there was a stay-at-home order here and many places, right? But we were getting
Right.
consultation calls. So the first couple of days, we were like, okay, we'll schedule them out 3 weeks. Who knew it would stay closed for 2.5 months, right? We'll schedule them out 3 weeks, we'll schedule them out a month. And then we realized we can't let them do that, because younger people, we all know, they're kind of like, I want it and I want it now. So we started doing Zoom consultations. And
can we talk about that a little bit? So let's talk about what is a Zoom consultation, because I think a lot of people have to understand there are unique ways we can now use telemedicine and teledentistry. So walk us through a little bit of that, if you don't mind.
Sure. Yeah, we also set up a telemedicine site, but the Zoom consults are what really sent the practice through the roof the last couple of months. So I have a concierge service that answers my phone, and so it's 24 hours. Someone's always answering my phone, and I think that's really important, because so many of these phone calls come at midnight, at 2 o'clock in the morning, because that's when these younger people are up and they're surfing the web looking for these procedures. That's when they're kind of interested in talking about it. So the concierge would send me a text the next morning, so-and-so wants a consult. I couldn't schedule them because we don't know when we're going to be open again. I'd have my office manager call them and set up a Zoom meeting, just like everybody's doing these days, to talk to everybody at work.
Right.
And then she treated it just like a consultation.
Right.
It's always within 24 hours. We always have to see them as within 24 hours. That's our rule. And
Great.
let's make a 30-minute meeting. She'd spend the first few minutes, just like we always do, talking about like kind of what do you have in mind for yourself, what's going on with you, very vague, open-ended relationship kind of questions. And then she'd ask them to take some pictures. And what we found was that these people were so open to talking about their situations, even more than when they're in our office. Because sometimes when people come to the office, they're apprehensive, but in their own living rooms and bedrooms, they were more than willing to do it. And that just like would get them to come really close to the camera and would take screenshots. So take 6 or 7 screenshots. Then she'd give me the bullet. I'd jump on, I'd talk to them a little bit. You know, you can't fully diagnose people, but you can build that relationship. They then have an idea of what you can do for them. I had a screen share where I'd show some pictures and then would schedule them for an in-office appointment. And,
okay, hold on.
Yep.
Hold on. I'm going to slow you down. Slow down. Okay. I know, Suze. Okay, so you're saying, are they taking their own shots of their smile and sending them to you? I just want to first go back to that. Is that what you said?
No, so we would have them get really close to the camera, smile,
Yes.
and then my office manager takes a screenshot of her screen.
Got it.
Yep.
Okay,
So
got
then
it. So you're taking, good.
We're taking the pictures.
Okay.
Move to the right,
Got it.
move to the left, you know, put your fingers in, and can you hold your cheeks back a little bit and get really close to the camera? I don't want to do
Love
it,
it.
but, you know, like close,
Right.
and then
Right.
hit the camera. Yep.
So, okay, so first pearl from Suze is hit the screensaver, save these images, and you've created already that interpersonal connection. I'm going to go back a little bit because this is a new concept to a lot of people. Your concierge service. Now, you're a businesswoman, I'm a businessman, we're both business people. Your investment in a concierge service, you obviously train them the right way to answer your office calls. Tell me ROI. Has this been a good ROI for your office?
For me, 100%. I really only need one appointment scheduled per month to make up the expense of having them. And we typically schedule about 15.
Hello, that was my next question. And let me ask you, this concierge service, where did you find them?
It's Tom Oren's service out of Massachusetts.
Okay.
Yep.
Okay. I know Tom, yep, go ahead.
And, you know, he's been doing a lot of, I think we've been aligned on customer service for my whole career. And he does a great job training people to do this. And it's worked for me. It works for my practice really well. And also we've used them when we've been short-staffed. Since COVID has started, I've had multiple staff members been exposed, test positive, be out for 14 days. So there are days that we leave this concierge service on all day long. So they're answering our phone all day. But I know that if there's anyone that has an emergency, they immediately text me in my pocket. And if they're scheduling all the people I need them to schedule. So it's worked out great for me.
I love that. So, because I just love these points for our viewers. Okay, now the patient, now you've grabbed them, you've done your Zoom meeting, and now they come into your office. Can you briefly walk through what you do in your initial appointment cosmetically with them, just as another point of reference for our audience?
Sure. I always have the same person who talk to them on the phone, greet them in the office, and give them a tour of the office. She introduces them to everybody. I think one of the main points for us is that we want to make sure everybody always feels comfortable at all times. So nobody is ever like, where should I sit? What should I do next? What is that? What's going on back in that room? So someone's always with a patient the whole time they're in our office. So they're coming in, we're taking their coat, we're sending them forms ahead of time so they're not sitting filling out forms in our office.
Right.
Although now, we have to screen everybody for COVID when they come in. So there is a little bit of that. Then she is sitting with them. We take them back in the operatory. Our consultations go on in the operatory. I've had consultations rooms, I just never used them. I'm always more comfortable, and our operatories are closed, so you can have some privacy in there. So she'll spend 10 or 15 minutes with them, and then ask them, and we want to make sure everything's always kind of like comfortable for them, and they feel safe and nurtured in our office. So she'll ask them if she can take a few photographs. And then we have that series of photographs from the AACD that we take, those 12 pictures. And then she'll bring those back to me and give me the bullet a little bit. And then and she also does an iTero scan on them. So we have the scan and the photographs. So neither of those things are, radiation or need a doctor to order those, right? So she can do those before we come in. And the scans are that blows people away, right?
I agree.
Many of them, they've never seen that before, right? Patients are like, wow, that's cool. Especially these younger patients, they expect technology. They expect, they just expect something different than our traditional patients, our more mature, if you will, patients expect, right? So we go through this iTero scan, the photographs, then she comes back, grabs me. I load the photographs up into my laptop. And then I come and spend a little time with them. I already have an idea of what they want and what I can do for them. I have a program loaded on my computer with lots and lots of before and after for patients. So I might sit and talk to them for a few minutes about what they, so I'll say, Delaney was telling me that you wanted to make your smile a little bit better. And it's always kind of vague, and I really want to get as much information out of them as I can. And then we'll go through, I look at their pictures with them on my laptop, and I'm sitting knee to knee with them. They're usually in a seat. I'm just in my chair. And then I flip through some cases that look like them. And I always will say, here's kind of what I'm thinking for you. But, if I'd like to take a CT scan then, or some x-rays, we'll do that then. But I'm the one that tells them what treatment I'm interested in doing for them. I show them other cases that look sort of like them. I give them a rough idea of what the fees are. I always like to talk about the fees myself first, and then Delaney will do a treatment plan and come up with the exact number. But I feel like, it's important that we own our own fees, and everybody's comfortable with that.
Hey, Susan, I'm just going to say, I couldn't agree more. I don't think a dentist should go through all of this and then just basically ask the team to show the cost to the patient. I couldn't agree more. Dentists should not be uncomfortable in ballparking fees. So I didn't want to interrupt. I couldn't agree more. Go on.
Yeah, and I always ballpark a little high, because then that gives them the opportunity to to be a little bit less. So it's even easier for them. And not all staff people are comfortable talking about money. You've got to find the right one, right? And that takes a little bit of training to get them comfortable and to have them understand how they go from presenting that treatment plan to getting that patient into a committed treatment process, right? Like a lot of people let it drop in the middle there. So I've spent a lot of time invested in training my people how to do that. So then my staff member will come in. I have a couple that can do this now, and I'll say to them before I leave. I always say a few things to them. I say, whenever you're ready to get started, I'm going to be here for you. Delaney or Darcy's going to come in here and she's going to tell you the specific fees involved, and our next step, and I'll tell them like kind of the process. We need to take a records appointment. At that records appointment, we're going to, take some more photographs. We're going to take some impressions perhaps, and we'll work out all the financials at that appointment. And if you're ready to do that today, that's great. And if not, if you need to schedule next week, we'll do it next week. And the last thing I always say to them is, I'm going to take really good care of you, and everybody here is too. Just so and I mean it, right? So they feel like it's personal for us because it is personal for us too. Then Delaney comes in.
Yeah. Okay.
Yeah, it does.
Go on.
Presents the treatment, and it takes a little bit of training for them to understand how to present treatment like that, how to present the fees, because I've already sort of softened the blow by telling them that, but she'll come in and talk about the fees, and what I always have to train people is you just have to be quiet. After you say what the fee is, you just have to wait and listen to what the patient says next. Because often, and I think all of us were trained to fill those spaces in. So if you say, and that's $25,000, and the patient says, and just kind of looks, doesn't say anything, we want to fill that space in,
Right. Awkward time, yeah.
Awkward time, right? Awkward time, exactly right. So then the gut reaction for them is, okay, well, let's go up front, and if you want to get scheduled, that's great. So they're ending the call,
right.
They're ending it themselves. So we just have to kind of wait, and and if they don't say anything at all, then we kind of have to ask them. So what are you thinking? And then we have to develop this little kind of like script to understand where they're coming from. Sometimes it's oftentimes it's not the money. Sometimes they're afraid of the procedures. Sometimes they have to think about how they're going to do it. Sometimes it's, I've got to talk to my husband about this. There's all sorts of things, or my wife about this. There's things like that. And we trained the staff to go through that. And I'd say about 25% of the time people are prepared to do their records right then. Out of the other 75% of people, 2/3 of them are scheduling their appointment, and then a few of them just aren't scheduling, and then we have follow-up procedures for that.
Right.
Yeah.
Right. Of course. So this is what I want to do. This is part one. So what I'd love to do is I want to film a part two. So a lot of our viewers only budget 15 or 20 minutes for these vlogs, so to speak. So I'm going to end right now. You're not going to go away, because we're going to go to a part two. So when people want to listen to part two, we're going to do a part two. So let's end right now, and we're going to bring you right back. So let me be clear. We want to hear from you. We want to hear your questions. So what we want you to do is we want you to go to education@midwaydental.com. Shoot us your questions. We'll go right to the experts. I know I'm not the expert, so let's go ask the experts what we should be doing as our next step next week, the week after, and thereafter. I look forward to hearing from you.